Oral questions by members.
Leader of the Official Opposition.
Thank you, Honourable Speaker. This June, a record-breaking heat wave saw blistering hot temperatures throughout large parts of our province. But the Premier and his government were not prepared to deal with the profound impact that this would have on people and the services they depend on. Instead, unbelievably, the Premier said he was, and I quote, giddy about lifting COVID restrictions. Well, while the Premier failed to act, 570 people died in British Columbia from heat-related causes, and almost 80% of them were frail, vulnerable seniors, 65 years and older. The Premier's response to these heat-related deaths was nothing short of appalling. He said, and I quote, "Fatalities are a part of life, and that there's a level of personal responsibility," end quote. So today, can the Premier explain his government's failure to respond effectively to the deadliest weather situation in Canadian history?
Minister of Health.
Thank you very much to the member for her question. I want to say at the beginning of this period for me, of this fall setting, how important it is that 100% of the people in this House are vaccinated, and that 100% of these people in this House are advocates of vaccination. I appreciate it. I'm grateful to the Leader of the Opposition, to the Premier, to the Leader of the third party for their leadership in that regard, and I'm appreciative of that. There are going to be important questions asked during question period, and that takes away nothing of the respect and the appreciation I have for the Leader of the Opposition in our joint efforts to work together to deal with the COVID-19 pandemic. It is the case that the heat wave that affected British Columbia affected people in all communities of the province, in particular in Metro Vancouver, but in other regions as well. As the Leader of the Opposition has said, in her preliminary review, the coroner has attributed 570 deaths to that heat wave. So I want to put it in context. The previous significant deadly heat wave in British Columbia was in 2009. 110 people died, deaths were attributed to that. The temperatures on the weekend in question, on the June 28th, 29th weekend, were 5 degrees higher than that. This was, as Dr. Sarah Henderson has said, a 1 in 1,000-year event, but it's happened. It's no longer 1 in 1,000 years, and it requires action to deal with resiliency and to support people. Everyone in this House, is gutted by the fact that people that we know in our community passed away that weekend. Gutted by it. We know that health authorities responded in advance of the event with heat warnings. We know that those efforts were made around British Columbia. We know our ambulance service responded and was challenged with not just more calls than they'd ever received before, but dramatically more calls. People acted appropriately, but we need to learn the lessons of this. That's why there's a coroner's review going on. That's why the BC CDC is doing a review, and its preliminary findings were delivered to the UBCM. And that's why I'm committed to working with everyone for action so that we have more resiliency. Because the fact of the matter is, this is attributable to climate change. It's no longer a 1 in 1,000-year event. We have to take action against climate change, and we have to take action collectively to make our society more resilient.
Leader of the Official Opposition, supplemental question.
Well, thank you very much to the Minister, but we should be perfectly clear that one of the jobs of the Premier of British Columbia is to make sure that when British Columbians are at risk, that they understand the seriousness of that risk. And a Premier that suggests he was giddy because he got to lift COVID restrictions and then basically says that people had personal responsibility is simply unacceptable, and the Minister knows that. This Premier should not have been surprised. In fact, he was warned in multiple reports about the danger. Not one, but two. reports. And he knew that it would have consequences for people like Howard Kalpis. Howard is 60 years old, and he lives next door to Oppenheimer Park in Vancouver. Howard happened to be in Vancouver Island when the heat wave hit, but his neighbors were at home. 3 of Howard's neighbors died as a result of the heat wave. Here's what Howard had to say, and I quote, "They died in their apartments, and they found them a day later," end quote. It's simply not good enough. A premier who said he was giddy, a premier who in essence said people had a personal responsibility, well, so did the premier and the government of British Columbia. So I hope that today this government will stand up and take responsibility for the lack of an effective response to one of the worst weather situations in Canadian history.
Minister of Health.
Thank you. And the member is right, I think, to this extent, that those affected most by the heat wave were the most vulnerable. Lower income, people who live in more social isolated circumstances. We saw that in the report presented by Dr. Sarah Henderson, Dr. Bonnie Henry of the UBCM. You see that in the evidence that we've done, and in the case-by-case analysis that will be coming from the coroner, I think we'll see the evidence as well. So there's a number of things I think we need to do in response to this. One, and this is not just a Ministry of Health question, this is a broader question for all levels of government and for all ministries. One, we need to, of course, continue jointly to take action on the issue of climate change, a central issue of our time. Two, we understand that climate change nonetheless is happening, and we have to become more resilient. This event was substantially worse than any other event we had seen in the entire history of British Columbia, and it presents challenges. And the healthcare system responded to an extraordinary extent. But the member is right. There is 570 stories to tell of people who passed away on that weekend. And we want to give value to that, and we want to respond to that with action. The government has already responded with action. We need to do more, become more resilient, and we obviously have to do our share in British Columbia to take action on the issue of climate change.
Member for Kamloops South Thompson.
Well, Mr. Speaker, people not understanding the severity of the heat wave that descended upon our province and that descended upon them, that led to dire consequences, tragic consequences. People not knowing what to do when this was occurring led to tragic consequences. Sadly, however, in 2019, the Premier commissioned and received a climate risk assessment for British Columbia. On page 69 and 70, it details the significant risk that a heat wave poses, referencing a high confidence of excess mortalities. But, Mr. Speaker, the Premier ignored these warnings. On June 27th, it felt like 44 degrees Celsius in Chilliwack. 74-year-old Roberta Bunny Lalonde, who lived alone in her condo, she turned on fans and opened her windows. But like many British Columbians, she probably didn't know that this would do more harm than good, because fans can actually cause someone's temperature to rise when the air is hotter than their body. As Bunny's daughter, Christine Lalonde, subsequently told the media, and I quote, "My mom was a bit stubborn. She probably thought it'd be fine. I don't know if she really knew the effects that heat like that can have on the body," end quote. On the afternoon of June 29th, Christine, who lives in Ontario, received a call from her uncle, whom she had asked to check on Bunny. And the uncle had let himself in, where he found Bunny lifeless on her bed. So I think British Columbians rightfully want the Premier to answer this question. Can the Premier explain, and the government explain why they failed to heed the warnings contained within a report that they commissioned in 2019? which would have ensured vulnerable British Columbians had a fighting chance to survive the heat wave. And can the Premier explain why, instead of heeding the warnings in this report, he instead responded to the tragedy by saying, and I quote, "Fatalities are a part of life," end quote.
Minister of Health.
Thank you very much, Honourable Speaker. I say to the member that the story that he told is one, obviously, that affected people in my constituency, people I know, and affected the whole province. This is, as Dr. Henderson said, a 1 in a 1,000-year event, but an event we now have to respond to. It's the new reality of our times, and we have to respond, and we have already taken action to do that. And that response will be broader than the Ministry of Health. And we've responded with more changes in our ongoing efforts to improve and improve resources of the ambulance service everywhere in the province. We've responded with changes in long-term care to bring in facilities, particularly facilities that hadn't had air conditioning, to add air conditioning and air conditioning capacity in those facilities. But the primary place where mortality happened, where people passed away, was alone at home. And so steps have to be taken. I will take the member through the steps that were taken by Dr. Henry, by health authorities, by others, by the Solicitor General, to warn people of the situation in the heat dome. But I think it's fair to say, living as I do in an apartment, an unair-conditioned apartment in East Vancouver, that none of us had felt the actual effects of what happened that weekend ever before, living in British Columbia, living in the Metro Vancouver. And simply put, we have to respond by becoming more resilient as a society. And I intend to work with everyone to see that that happens.
Member for Kamloops South Thompson, a supplemental.
Well, Mr. Speaker, the fact of the matter is this. The Premier and the government ignored their own reports, which they had commissioned several years in advance of this tragic situation. And as a result, thousands of British Columbians were not truly and fully aware of just how serious the risk was. As a result, emergency systems were overwhelmed. As a result, first responders were swamped and they were overcome. They were overcome with tragedy. The government's actions, simply put, were too little, too late for almost 600 families who lost their loved ones. Were too late for vulnerable British Columbians like Bunny Lalonde. Now, this fall, Bunny was going to go and visit her daughter in Ontario for the first time in 12 years. Instead, like so many others, she died from the heat alone in her condo. This is how Christine remembers the phone call from her uncle, and I quote, "He said, 'She's dead, Christine. She's dead.' It was devastating," end quote. On June 29th, the same day as that fateful phone call, the Premier called such fatalities, and I quote, "a part of life," end quote. Mr. Speaker, we're talking about vulnerable British Columbians. We're talking about British Columbians who deserved so much better than this. Will the Premier admit today that he was wrong to say that vulnerable British Columbians like Bunny had a level of personal responsibility? And will the Premier admit today that his ignoring his own advice, the advice in his climate assessment report, in fact, had deadly consequences for hundreds of vulnerable British Columbians?
Minister of Health.
Thank you very much, Honourable Speaker. The government, as the member will know, is pursuing an exceptional, leading climate action plan led by the Minister of the Environment. The government has been addressing issues of inequality, because this is fundamentally a question of inequality, by increasing income assistance rates, increasing disability rates, supporting vulnerable people in community. The government raised the level. 85% of care homes were below the provincial standard in terms of long-term care staffing. We raised those levels. That helps us prepare, Speaker. And there's more needed to be done, and there is more that's going to be done, because this was an exceptional event that even with the extraordinary actions to address climate change, to address inequality, the largest increase in the history of the BC Ambulance Service, that went from $424 million when I became Minister of Health to $559 million in advance of that. And now we've seen since then significant action taken. All of these actions make us more resilient, but we need to do more. That is evident. This is a period of climate change that is going to affect us now, next year, the year after. We need to take action on climate change, and we need to take action to ensure that British Columbia becomes more resilient to the effects of climate change.
Leader of the third party.
Thank you, Honourable Speaker. It's astonishing to hear this conversation back and forth between the two parties and to be discussing climate change and to hear this government talk about their climate change plan and ignore the fact that they doubled the public subsidies to oil and gas that the previous government had to $1.3 billion a year. This government is funding climate change. It is funding these outcomes with public money. This province is facing overlapping crises, Honourable Speaker. We have the heat dome, we had the wildfires, and we are now in the fourth wave of this pandemic. And one of the communities the hardest hit is the unhoused. As this government touted an early and premature recovery from COVID at the beginning of the summer, supportive housing options to isolate safely were quietly rolled back. A September memo in Vancouver Island Health referred to us being in the endemic phase of COVID and stated that the official response to unhoused people with COVID-19 is to give them a snack, a mask, and education. And in my riding, that meant a 66-year-old man with COVID and nowhere to go, and COPD and a fractured hip was given the advice to sleep in his vehicle. And now the crisis has reignited after hundreds of cases of COVID-19 were diagnosed in Victoria's unhoused population last month. The government hastily promised 50 new beds for people to use to isolate and recover. But the number of beds is inconsistent with the number of cases, and people don't have a month to wait. They're sick, it's getting colder, and the virus is spreading. Honourable Speaker, my question is for the Minister of Health. All of the data this summer showed that the pandemic wasn't over. Why in September were health authorities rolling back supports for unhoused people when the data pointed very clearly to a rising fourth wave?
Minister of Health.
Thank you very much, Honourable Speaker. Some of that question's for the Minister of Housing, so he may respond on the second supplementary to the member's question. But what I would say is this. We are in the fourth wave of the COVID-19 pandemic. That's the position of every health authority, and that's my position. That's why, in our step-by-step reopening plan, we're still at step 3. It's why we did more tests in the month of September than at any time. And our focus from the beginning of this pandemic has been to focus on those who are most vulnerable in every way, whether they're in long-term care, in assisted living, or they're most vulnerable in the community. I am very proud of the work of health authorities in communities around the province that we started in congregate living circumstances to vaccinate people and continued that effort. While we provided unprecedented housing options and isolation options for people. There are challenges now, because as the member will know, some of the facilities that we did, some of that cohorting of people who are sick are now being used for guests and visitors and so on. Nonetheless, it is an unprecedented continuing effort to support, to vaccinate our most vulnerable people. I think the fact that we did it early and the fact of that effort, I think, created maybe a false impression that we were ahead in those areas of everywhere else. The downtown east side, for example, of Vancouver has over 80% of people vaccinated, about 82%. Nonetheless, that is below other community health service areas in Vancouver. So we started there soon, but they were overtaken when it was offered to everybody. The efforts to vaccinate, the efforts to support, the efforts to house continue unabated and will continue unabated as we deal with this phase of the COVID-19 pandemic.
Leader of third party on a supplemental question.
Thank you, Honourable Speaker, and thank you to the Minister for his response. However, there is an online memo in Island Health that clearly states we're in the endemic phase and that there won't be supports provided to unhoused people, September 21st. COVID isn't just impacting unhoused people in Victoria. Across the province, unhoused people are getting sick and have nowhere to go. In Kelowna, 130 cases in the unhoused population weren't even recorded on Interior Health's list of public exposure because it wasn't, quote, a risk to the public. But unhoused British Columbians are the public, and they are at risk. These are people with lives and loved ones, people who deserve the supports they need to keep themselves and their communities healthy. The similarities between this and the lack of action on the drug poisoning crisis are striking. Unhoused people do not receive the same level of care or investment. My questions for you, Honourable Speaker, is to the Attorney General and Minister for Housing. Yesterday, the Minister said that his government is working to find isolation spaces for unhoused people in Duncan, Nanaimo, and Prince George. When can unhoused people in these and other communities across the province expect to have their needs met urgently?
Attorney General.
Thank you very much, Honourable Speaker, and thank you to the member for the question. There are a number of assertions the member made in her question that are not accurate. People who are COVID positive in Victoria, who are unhoused, can come inside if they choose to. We have space. The same is true in Vancouver. The same is true in Kelowna. But it is not the case across the province, and I accept that. We have a very serious situation in Trail. And BC Housing is working overtime with health authorities and with our nonprofit partners to make sure that if people are COVID positive and they want to come inside, because frankly, not everybody does, that they're able to do that. I would just underline the fact that the member's question starts at a certain point in time, omitting all of the work that was done by health authorities, by BC Housing, by nonprofit organizations to get people inside. 300 people were living in an encampment in Strathcona Park, 250 people in parks in Victoria. All of those people are housed now. They're inside. And it was a heroic effort by BC Housing and by nonprofit organizations, and that work continues. And the system is stretched. It is strained. People are working overtime. Staffing is stretched to the limits, and even so, 50 additional spaces were opened in Victoria to respond in time to make sure people could get inside if they wanted to. So a huge amount of work is done. I just want to thank everybody who helped deliver those results and who is still working overtime to respond to the fourth wave across the province.
Member for Surrey South.
In 2019, government received a strategic climate risk assessment that said, quote, over 100 excess mortalities could occur in BC and over 1,000 people could experience negative health impacts, end quote. But instead of acting on the warning, the Premier blamed those who died, saying, quote, it was apparent to anyone who walked outside that we were in an unprecedented heat wave. Again, there's a level of personal responsibility, end quote. Ignoring advice has consequences. It was government that was unprepared, with ambulance response times taking up to 16 hours and people dying, waiting for that help that never came. The health minister a minute ago said a number of things need to be done in response. The report was 2019. Government's had a couple of years to put things in place. So perhaps the Premier's cleanup crew would like to explain why the Premier blamed vulnerable seniors and people who couldn't afford air conditioning for their own deaths.
Minister of Health.
Thank you very much, Honourable Speaker. I simply, and I'll just say I disagree with the assertion of the Honourable Member, but what I'll say is this, that what you see in terms of vulnerability is the challenge of social isolation. Prior to the pandemic, the member will know, took unprecedented action for adult day programs for seniors, to increase home support for seniors, and in fact, people with home support were less vulnerable in this time, to increase respite care for families to support seniors in community and in care. These are unprecedented actions that have been recommended by the Seniors Advocate and others for a long time, that action was taken in those areas. with respect to the BC Ambulance Service, a dramatic increase in the hundreds of new people hired and new ambulances put in place, including air ambulances to support our ambulance system. In terms of inequality, significant action for people with disabilities, significant action for income assistance, extraordinary action in the area of housing. And yet, and let's acknowledge this, on that weekend, we lost people. We lost too many people. And my responsibility as Minister of Health, and all of our responsibilities, is to work with everyone we can to ensure that we are prepared for what is coming, because this 1-in-1,000-year event will no longer be a 1-in-1,000-year event. It has happened, and we have to take action accordingly.
Member on supplemental.
Thank you, Mr. Speaker. The minister's right. There were too many deaths. But the Premier blamed people for their own deaths. First responders in British Columbia thought the Premier's comments were out of line. Take the words of the president of the BC Professional Firefighters Association, quote, "It's sickening to hear those comments. We have a large percentage of our population that don't have access to proper cooling in buildings that they live in," end quote. Again, the Premier needs to explain why he chose to blame the victims of this tragic heat wave for their own deaths.
Minister of Health.
Thank you, Honourable Speaker, and thanks to the member for her question. The Premier, myself, every member of the government, I believe every member of the opposition understands now, if understanding was needed, and I think it's fair to say all of the actions taken on the issue of climate change demonstrate that commitment that has been there for years for people in this legislature, the need to take even more action to be more resilient. This was an unprecedented event. We had an event, the member refers to the report, we had an event in 2009. At that time, 110 excess deaths as a result of a heat event that was mostly centered in the Fraser Health Authority at that time. But it took, I would say, till 2018 for the heat warning system that applies everywhere else in the country to be applied by the federal government to British Columbia. These events are the result of climate change, and action is needed to respond to them. Since 2017, the Premier has shown his commitment by addressing inequality, by addressing climate change, by supporting people where they need help. I think he is committed, as every member of this House is committed, to supporting people and to responding to the impact of this unprecedented heat wave. We are going to receive soon, I believe, sometime in the future, the report of the coroner, which will be a case-by-case analysis of what happened. That is the independent review as required. The BC CDC and the Provincial Health Office is doing its own review. You saw the preliminary findings at the UBCM, which were shared with the opposition, and it's our intention to continue to become more resilient as a society, but also continuing our efforts to deal with inequality, continue our efforts to deal with social isolation, and continue our efforts to fight climate change.
Member for West Vancouver, Capilano.
Thank you, Mr. Speaker. Now, 570 is a number, and on behalf of British Columbians, we have to continue to put a face to that number and a face to that tragedy. Brian Bertuzzi is the assistant fire chief at Fire Hall Number 5 in Vancouver. And on June 28th, Brian describes the chaos at the fire hall like it was a war zone. Every fire truck in the city was out, and firefighters were stretched to their limits and unable to help everyone who needed it. On the fire hall driveway, an elderly man was dying as Chief Bertuzzi administered CPR. The next day, the Premier was giddy and dismissed the heat wave deaths as a fact of life. This after ignoring his own climate report assessment that warned that these kinds of things could happen. So why did the Premier describe the systemic failure as a matter of personal responsibility?
Minister of Health.
Well, Honourable Speaker, first of all, and as the member will know, since that weekend, but throughout my time as Minister of Health, I've done a lot of work with firefighters, with ambulance paramedics to improve emergency response in BC. I think the work that firefighters and ambulance paramedics and emergency room personnel and health authority staff and home support workers and all those people in the healthcare system in the midst of 2 public health emergencies who went above and beyond that weekend deserves our thanks. And I believe, Honourable Speaker, and I was agreeing, I think the member, the Leader of the Opposition is misunderstanding. I wanted to make the point that everybody who worked that weekend and responded above and beyond the call deserves our thanks. And I know that the Opposition agrees with that. That was not a point to be made or even a suggestion that anyone else thought differently, just to be clear. I think what's required now, and what we've done with respect to first responders, for example, is taken in addition to the largest increases, other than mental health and addictions, the largest Ministry of Health increases since I became Minister of Health were to the ambulance service. Number 1 has been mental health and addictions. That's been dealing with the overdose crisis. In particular, number 2 has been ambulance paramedics, which also, to a great extent, we'd all agree, is addressing the overdose crisis, because ambulance paramedics are frequently, and firefighters are frequently on the front lines of that. And so what's required, it seems to me, is continued investment in first responders. When people call for an ambulance, they need to get an ambulance. And the fact that we went from $424 million to $559 million is great, but when you need an ambulance and it doesn't come, that's not good enough. And so we add services. And so what has that meant? Since then, we're hiring 85 new ambulance paramedics, 24 new ambulances, 30 more dispatches, upgrading services in 24 rural communities, upgrading services to 24/7 full-time staffing, upgraded services in 26 other communities, because that response is needed as well. When people call for an ambulance, they need to get an ambulance, and that's what we're committed to seeing happen.
The bell ends question period.